press, brothers and sisters from press. I welcome all the patients who have been already treated here. Thank you for making it to this program. And I would also like to welcome Dr. Estella. Dr. Estella is the medical attaché from Tanzania, and she is working at the embassy of Tanzania in Delhi. And she is here right now as a patient attendant. Her mother is undergoing a knee replacement. At the same time, she also she sends us cases. We get a lot of patients from Tanzania, and we have been treating. And she is the person who interacts with us and looks after the patient. In between, she comes here, to find out how the patients are. The Western region for the first time, that is Dr. Chirag Shah who started. And I'm very happy to announce today that almost 20 cases we have done with more than 90% success rate. If I'm not wrong, we lost only one case out of all 19 patients. Otherwise, rest, everybody is here, and you all can see our patients are they are all here. Now, just to take it a bit forward on the same topic, I will request Dr. Chirag Shah to just speak on his venture, his endeavor over here, and how he has started and what is his future plans on this. So, Dr. Chirag sir, thank you.
Once again, thank you all for coming, all the patients and family members. The press may not realize how difficult it is for these people to go through these treatments. It is physically, emotionally, and in every way it is a very difficult treatment, I must say. And in spite of that, they keep up their courage and they continue to fight, and that gives us also many times inspiration that how we should not give up. Because many times we also get tired of seeing difficult things, and they give us courage. I joined here in about 2005 after coming back from US, and it took us a couple of years to get the things established, because this was a very new hospital. And over the 1.5-2 years, we first started with taking care of serious diseases like various blood cancers and various other cancers, various blood disorders that need very complicated care. And so over time, we had a confidence in the system. We built the team which can take care of complicated cases, because all this was new for this area. We had seen all this in US, but all these concepts were new, and such kind of care was not possible in smaller hospitals. We needed a place where everything is under one roof. You cannot send a sick patient out for a CT scan or for MRI, or not have the relatives run around for blood. That okay, you go to one blood bank and get blood. We have everything here in this hospital, and again, this, when you talk to them, you will realize the importance of having everything under one roof, because many of them are from out of town, and not all of them have relatives here to give blood. So we have drives inside the hospital also to collect blood, to help out. Our staff has given many times blood and various blood products. They have themselves sat on machines to give platelets to these patients. Our blood bank director has himself done that. So all these efforts go into establishing these things so that we can go forward. So with all that, in 2007 we started Transplant, and it came as once again more from patient than from us, because this was a 6-year-old child who had come from abroad, from Africa again. And this patient had a very bad cancer which had not responded to the routine treatment. So his tumor did not go away at all. Now this kind of patients have no outcome with standard treatment. Nothing, you cannot do anything really. And so we referred them to other transplant centers, but they had developed so much trust, so they declined to go. Family, and he was married just about how many months ago?
2 years.
Before 2 years. But the child was on way, right? The wife was pregnant at that time. So obviously there was very emotional attachment at that time to do the best possible for conditions so serious like acute leukemia. And so they wanted the best done. We talked to them that we just started the program, but just like the first patient, they had a lot of confidence. They said, no, we are doing everything here. And so, it is more many times that the patients have given us push and confidence. And so we did, and then it has just been a smooth course almost with 20 transplants. We had, of course, some difficulties. This you will hear more detailed presentation in the auditorium as to so many different steps need to be taken care of in getting a transplant through. So it involves many people. One of few of them are sitting here, Saraswati Ben Amin, our transplant coordinator. So there are lots of steps that she takes care of. Our nurse in charge, Ms. Upasna, is sitting here, and of course from operation side, Shatrujit, and so many people that we will show at the auditorium. We need their help, and with all that we have been going through this program well. As I said, we had some setbacks. One patient who was a doctor who had a leukemia which had come back, and he was not having a good match from a brother or sister, but he really wanted to do everything here only with same kind of trust in the system like other patients had. He was the only one who could not be discharged from the hospital. I'm going to show the data, compare the international versus our results, and I don't want people to feel that this is a very smooth procedure and that everything always goes well. Even the international numbers are not 100%. And far from 100% over the long time. So we want to emphasize that this is a life-saving treatment being done for difficult diseases where there are no other options. Now, with the confidence that we have developed over these 20 transplants in the team and the capacity of everybody, the infrastructure, we are going ahead now with more of pediatric transplants, where we will be starting thalassemia transplant, which many of you may know that is very common in India, with about 50,000 patients in India, and there is only one dedicated center doing thalassemia transplants in whole India. We have in Gujarat 5,000 patients and 1,000 new being diagnosed every year. 1,000 new patients, in spite of so much awareness programs and all this going on. It's a huge number, and this is one disease which has a very good cure rate with transplant. In Italy, they have a 94% success rate from transplant. In India, so far it has been 80%, but even 80% is very good. If you know any thalassemia patient, what happens to them? They survive only for about 10 years in most cases, and if you do very good care you do lot of efforts, then they survive about 25-30 years, and it is a very expensive effort to do all this for up to 25-30 years. You end up spending about 15 lakh rupees. So the transplant comes out to be actually cheaper also from that point of view. And we are building a new 6-bed stem cell transplant unit, which is the walls are all ready, just the finer details are to be done. So we should be opening that in about 2 months time. And we are going ahead with some newer techniques of transplant also, as we will now expand to more difficult transplant cases. Apollo Chennai is the only hospital in the group of 50 hospitals who does these transplants regularly, and so we want to be the first in this region to fill the gap, which has always been Apollo's way of doing things, that they've always been first in majority of areas. You take the first best MRI, first best CT scan in the country, liver transplant, so many things. So to fill the gap in this area, and we have one very important addition, stem site in this hospital campus, which is a umbilical cord blood depository, which will allow us to do many umbilical cord transplant, because many patients don't have donors. Everybody doesn't have a brother or sister that matches as a donor. For these people, you need these additional sources of transplant, and that is umbilical cord blood. And stem site is world's number 1 in this field, in storing and processing of umbilical cord stem cells. So that has opened its campus in this hospital. Their project in this hospital campus, that also tells you that how the world has recognized this hospital's ability to be a leader in transplant. That is why they opened their first campus in Southeast Asia in Apollo Ahmedabad. So those are some of the things that we are going ahead with, and if you have time, you can join us in the auditorium later, where we will give more details also. Thank you.
Also, what you all need to understand that how difficult this process is. You can understand from this fact that out of all 50 hospitals, only Apollo Chennai is doing, and this would be the second hospital where we are starting this. And it is a very lengthy process. The patients might have to stay for months and months over here, and they are confined to a particular area. Right now we have 2-bedded stem cell ICU, and if you go and see, it is altogether different from the other ICUs. Even in other ICUs, as a doctor, he cannot enter in this stress. He has to change and then go over there. The kind of precautions which has to be taken for these patients, these kind of patients, is far more difficult than the normal ICU patients. So there are a lot of things, and if you want, we can show you the 2-bedded ICU, how we have made it. And another 6-bed we are coming up. We are going to start with the pediatric. Till now we have been taking only the adult cases, but we are starting with this pediatric case once our facility is open.
And we are having a dedicated hemato-onco ward dedicated for the patients only. No other patients are there in that area. So if you go and see the first floor, you can have a quick look on that, where you can, I think they can go up to that easily. And because ICU is highly kinetic, the inside, but of course that dedicated ward for hemato-onco patients.
Even there also hemato-onco
very precise
things. The patients who are more critical, we have a different area, and where the movements are restricted.
You can feel
you can't just enter that.
How many stems have we done in a year?
We have done 20 as of now.
20 in Ahmedabad?
20 in Ahmedabad.
And now
This we are talking only in Ahmedabad.
And
What are the diseases?
So
Yes.
now averaging we are doing
the kind of cases what we got, it is all cancer. It's all cancer related cases, and no, we haven't done the thalassemia.
That is what we are starting next. As
a plan.
you can understand that the children are very delicate, and that now we have always tried not to be in a hurry to do things. And wherever it has been done like that, people have had very bad results and loss of life. So we want to be very slow in this, and that is why we have taken this length of time to establish the infrastructure and do things well. And again, as he said, you can understand that out of 50 Apollo hospitals, if only 2 are doing, there must be some reason, right? That's
even under the construction, while construction, I'll give you brief about the construction. What are the things which goes inside that? Say the air which is coming there, we have to not only just filter it with the HEPA filter. Even we have the provision. We are going to make a provision of UV light, so the air will pass through the UV light just to make it absolutely bacteria free. The number of air exchange which takes place, say this is the room and this is the AC, there is a constant air exchange from the fresh air comes in and some part is circulated. So we usually do it for ICUs around 15 to 20 air changes per hour. That is what we maintain. But for this area, we have to increase the air change roughly to the extent of 40 to 50 times in 1 hour. So almost you get absolutely fresh air all the time, and that is bacteria free. So these kind of setups, when you have to make it, it takes its own sweet time. You can't just make it in one day. Lot of planning goes into each and every aspect, so that these patients don't get exposed to any kind of infection in the hospital. We are all surrounded by bacteria and viruses, but for them we have to have a room or the place where there is a minimal number of bacteria. In fact, if we can, once you try to make it zero, that is the whole.
So once the patient will get treatment hit, what's the follow-up after that?
Well, follow-up depends on different condition, because there are so many different cancers and so many different blood diseases for which it is done, and many of them don't need any treatment after that. Some need simple medications after that, and some need more complex blood testing and follow-up after that. So there are sort of 3 levels of care required post-transplant. See, we have done 5 international patient transplant, which you can understand that they are not able to come back for follow-up. So with their doctor, local doctor, we are able to manage. So that also gives you some idea that yes, it is possible. Of course, we prefer if patient comes here more often, but in India there are few centers, but many countries abroad there are no centers in whole countries or several group of countries. So we take care of those also.
What is the package?
Since there are many different diseases, there is no package, and almost nowhere in the world that I know of there is a package, because there is so much variation. So some patients bill would be in the range of about say 4 lakhs, and for some it can be up to 10 lakh or sometimes plus. So it's a very wide variation.
But is this cheaper than international one?
Any day.
Oh.
Any day.
Much.
Let me tell you, the outside will be charged just in dollars. The same amount in dollars it goes.
No, actually, I mean so many patients go to Singapore from here. Just 1 minute. So many patients from here go to Singapore. There the charge is 50 lakh rupees, and in US it is average $150,000 to $180,000. So that would be how much? Anybody good in math?
Around 90.
We have a chartered accountant.
Yeah, 70.
So 90 lakhs.
80 lakhs.
80, 90 lakhs.
80, 90 lakhs.
So that is the cost of transplant abroad.
Roughly 10 times. I mean, any time you see.
In Ahmedabad civil hospital,
Yeah, in the cancer hospital, they have been doing some transplant, right?
inside what about this stem site?
Stem site is a depository for umbilical cord blood, which is a very rich source of stem cells, and these stem cells have some extra properties which make them better than the adult stem cells in some cases. And most important is that for those who don't have a brother or sister or other relative match, you have no other option. For them, umbilical cord is very useful, and worldwide already over 15,000 transplants with umbilical cord has been done. Over 15,000. So it is no longer something experimental or new. It is far from new. Okay?
I think you can explain what is stem cell.
I mean, stem cell is the seed cell, you can say, one of the earliest cells in the body, which has the ability to repair the tissues when they are damaged from any disease. For example, if somebody has a heart attack or they have a lot of bleeding, how do you repair that? How do you replace that? So normally body does that by moving the stem cells from either in the same organ or from the bone marrow. Bone marrow is the biggest source of stem cells in the body, and from there they move and go to the area where it is required to do the repair, and they differentiate into cells of that particular type. Now, many times it is not sufficient what is done by the body, like in so many different diseases. Body always tries to do many things, but in several diseases it is not enough, it is not sufficient. So that is where we need the medical help is required.
जिस तरीके से एक सेल जो है ना एक बॉडी को बना देता है, वैसे ही ये उसी तरीके के सेल होते हैं जो कि एक सेल से लेके डिफरेंट जैसे बॉडी के पार्ट्स बनते हैं, उसी तरीके से ये भी प्रोलिफरेट करके डेवलप करके उस एरिया को ये करते हैं.
પેશન્ટ્સનું પહેલા હરિભાઈ બધાની વખાણ કરાવું છું. અને હરિભાઈ એક કપડવંજ પાસે.
I think we'll request them to change their names. One request to all of you that, like, when you are, in case if you are writing the name of my patients, please change the name to some.
No actual names.
No actual name. Don't give the actual name because sometimes it becomes a social, stigma.
Yeah. Local patient. Bhavesh Mehta from Surat.
Govind Rathwar, Baroda.
Santilal Dethakar from Anand.
Pernamwada, Kapan.
Kutch, Bhuj.
Strength wise minor different લાગે, બાકી as you can work first and after there is nothing change. હું પહેલા જે વર્ક કરતો હતો અત્યારે પણ એ જ વર્ક કરું છું. ક્યારેક એવું ફીલ થાય કે થોડીક ઇમ્યુનિટી ઓછી પડે સ્ટ્રેન્થ વાઇઝ, બાકી ઇટ્સ નોટ અ ડિફરન્સ.
અત્યારે એવું લાગે છે ફ્રોમ ધ રિટ્રોસ્પેક્ટ કે 2 વર્ષ જ્યારે કરાય ટ્રાન્સપ્લાન્ટ ત્યારે પણ કીધું કે 2 વર્ષને અંતે